Morning. First, I just want to start this video off by saying that I feel the ASQ assessment or questionnaire, it can be a really good tool to use when assessing child's developmental stages, not only in the Southwest, but in any area or any population that you're going to be working with. I really felt like I was able to sit there and pay attention to this child and ask really in-depth questions and gather a lot of information that I wouldn't have normally been able to gather in just asking questions, regular questions, without actually seeing the child, how she used her hands, how she tried to figure things out, to problem solving skills. So it was a really good tool. I got to see the benefit of also gathering information from the parent and watching the child in her own environment, not in a clinical setting or in an office setting where the child wouldn't have been as comfortable. The child was a lot more comfortable in her home. So I also feel like, due to that fact, I got a more honest, thorough assessment. With this child, I had a sense of the fact that she has two different type of roles. At home, her parents let her, even though she's 20 months old, they let her continue to drink out of the bottle. They don't make her use utensils to eat her food with. They let her use her hands. They really don't. I don't see them promoting or pushing her to be right on track for her age. A 20-month-old child should not still continue to be on the bottle, should be using utensils to try to eat. They don't speak to her with complete sentences. They talk to her baby talk. And she's a very smart child. According to parents in the daycare, that's not allowed. So in daycare, she has to eat with utensils. She has to drink out of a sippy cup. And she does that quite well, according to parents. So they're aware that she's able to do it, but they still don't make it happen at home. Not sure if this is because they have 6 children, they're so busy, they're just kind of tired with her, they just kind of don't try anymore. Not sure, but I did take all that into consideration when writing the paper and making my assessment with this child. I also believe that this is something I definitely would use again in the future if I was working with the child population. I like the fact that it was done in the child's environment where the child was more comfortable to be herself. So that's something that I don't know if in working with that population would be a possibility again. But in the social work field, I would hope that that is something that would be a possibility, to do a home visit or go out in the field. So for future use, that would be my biggest takeaway thing, is the fact that, when doing these types of assessments or any type of assessments with any population, to do it in an environment where they're more comfortable in, and to take everything into consideration. Again, like I said, the fact that she kind of has 2 different behaviors, 2 patterns of behavior, 2 different sets of expectations for her, one in her home, where she's allowed to kind of regress, and one in the daycare environment where she does what's expected of her and she knows what's expected of her, and she can see peers around her that are her age behaving a certain way. So at least she does have that. So that is something to take away from this as well. Overall, I really enjoyed this experience. I've never worked with the child population before, and so this was really good feedback for me, and it was a really good learning experience. Thank you.